In this video, we'll talk about some of the drugs that help people with sleep disorders. Now, while this isn't a part of our textbook, it is something that students often ask questions about in class, so I've included it as part of the lecture material. Benzodiazepines are the classic sleep aids, and benzos work as a GABA agonist. And so you can see here with this GABA receptor complex, GABA has a binding site, and when it binds, it's going to open an ion channel, allowing chloride to rush in. That negatively charged chloride ion or ions are going to inhibit the postsynaptic cell. Benzodiazepines also have a binding site, meaning that they act as a GABA agonist. They're going to mimic or increase the activity of that neurotransmitter. Now, benzodiazepines, they're going to modulate the activity of GABA. So they're going to either keep that channel open for longer or open it for wider, allowing that cell to become more negatively charged. So again, it's increasing the inhibitory effect of GABA. The benzos that are prescribed for sleep are typically shorter acting ones like Restorol or Halcon, but there are some others that are also used as anti-anxiety drugs like Ativan, Xanax, and Valium that sometimes are also used as sleep aids. Unfortunately, because they are short acting, they can also be more addicting in nature. So there are also Z drugs that appear to be GABA agonists, perhaps binding to a different site, and supposedly they are less addictive. These are drugs like Lunesta, Ambien, Sonata. Those are the ones you hear about most of the time. You see the commercials on TV for all of these. Well, I've never taken any of them myself. I certainly have known people that have taken all three of these. People that have Ambien, sometimes they'll only take a half so that they don't have, any ill effects the next day. A newer class of drugs are orexin antagonists. And so remember, we said orexin is arousing. It's released from the hypothalamus. One of the areas it's going to stimulate is the basal forebrain. So the antagonist is going to block these arousing effects of orexin. One you may have heard of is Belsomra. They're supposedly, because they're not working on GABA, there are less side effects, less addictive, and they don't really have as much of an effect on cognition, and they are newer and FDA approved.